Hello, welcome to BEH 229, Family Counseling. Today we're going to conduct a comparative view of family therapies and theories. So, most family therapists start out following one theoretical framework and its set of clinical procedures. But soon, they learn to supplement and adapt where the theory is inadequate for certain clients. In practice, most therapists become diverse in their approach, ultimately adopting and adapting techniques that their experience tells them work best with specific sets of problems. Basically, the more you practice, the better you get. The personality and interests of individual therapists also influence the theories they choose to practice. With so many theories, some investigators have attempted integration. The question of integration raises numerous issues in theory, clinical practice, and training. Many of the early family therapy pioneers, such as Bowen, Jackson, Wynne, Bozormeni, Nagy, were largely schooled in classical psychoanalysis, and they eventually came to reject the psychoanalytic focus of intrapersonal dynamics, the monadic view that problems reside within the individual that prevailed among psychoanalysts of the time. Instead, they insisted on the then radical position that people can be understood accurately and can be more easily helped if viewed in the context of their relationships. These all require the broader dyadic, or two-person, or triadic, three-person viewpoints. Today, there is less polarity, intrapsychic or interpersonal among models than a difference in emphasis. All family therapies attend to individual, dyadic, or triadic factors in family functioning. The differences lie in the weight and focus they give to each. By definition, family therapists conceptualize from a dyadic or triadic position, recognizing that people define one another and themselves through their interactions. Another dimension with which to compare models involves how theories consider time, meaning the past, the present, or the future. Early family pioneers broke with the psychoanalytic exploration of the past for explanations of current difficulties, preferring to focus on here and now family interactions. Without denying the influence of past experiences on present functioning, most theorists look to ongoing transactions, turning to past experiences only if necessary to enhance understanding of current family dynamics. Today, among family therapists, there remains disagreement on which time frame to emphasize in dealing most effectively with the family's presenting problem. And you know, we get back into this postmodern approach of you can't change the past, you can only manage the present and the future. So a lot of this concept is based on a more modern perspective on things. The past remains an important element of all contemporary psychoanalytic informed family therapy, but with the greater attention today on relatedness, current real relationships among the family and the therapist also are important in therapy. The conscious cannot know or experience the measurement of time. This is what allows for past experience to be relevant to today. From the perspective of the unconscious, projections and identifications are timeless. One learns in therapy how to relate to them in the here and now through conscious awareness. All theories have at least an implicit, if in some cases unstated, viewpoint regarding normal family functioning. Bowen essentially bypasses the issue of normality and the related issues of differentiation and the separation of emotional and intellectual functioning. So how well that person functions then is dependent on the level of stress they encounter or are able to avoid. The ideal marriage, according to Bowen, is two highly differentiated partners who achieve emotional and intellectual intimacy without a loss of autonomy. So you're emotionally happy, you're intellectually intimate with one another, you know each other's thoughts, dreams, hopes, and concerns, but you're both still independent of each other. Modern psychoanalytic theories, including object relations viewpoints, say a lot about functional and/or dysfunctional families. They stress the importance of the infant's attachment to the mother or other caregiving figure as crucial to the development of a strong, cohesive self in an adult. Internalized images and interjects from the past shape future relationships, including marital choices. From the perspective, dysfunction arises from societal pressure to deny and suppress natural impulses, consequently inhibiting spontaneity and growth. So let's compare these 5 elements of the therapeutic process: the therapist role, the model's use of formal or informal assessment procedures, the issue of insight versus action intervention mode, key methods of intervention for each model, and the duration of therapy, whether it's crisis, brief, or long-term, and ultimately the goals of therapy. Psychoanalysts are interested in creating a safe environment in which to examine and attempt to resolve the client's unconscious conflicts that interfere with current family relationships. By providing insight into intrapsychic or interpersonal conflicts, they then examine transference and countertransference reactions. Narrative therapists help clients write a more robust narrative of their own lives. Many contemporary psychoanalysts support the mutuality of the therapeutic interaction as a means of writing a new conscious story. Narrative therapists, as co-authors, help clients develop new meaning, using questioning to aid clients as they revisit and rewrite old, self-defeating stories, replacing them with preferred, empowering stories about actively directing their futures. Experiential family therapists strive for active, spontaneous, honest, and open encounters in therapy. The therapist functions as a role model for straight talk and clear communication, all directed at increasing client self-esteem. Bowenian coaches attempt to minimize their emotional impact on the family, and in turn avoid being caught up in any family emotional turmoil. They are careful not to be triangulated into the family's entangling conflicts to help members gain greater self-differentiation. In other words, taking those I positions. Structuralist therapists hover in and out of the therapeutic process at key points. Structuralists join the family system in a leadership role, accommodating the family style, map out the structure the family has developed, and go about helping them change that structure to adapt to changing conditions. Using a wide variety of techniques, they tailor interventions to specific symptoms and custom design problem-solving strategies to eliminate the presenting problem. Solution-focused therapists help clients define the changes they are looking for. They do not spend time speculating on the origins of presenting problems. So again, we get into this postmodern idea of where the problems came from, we can't fix. We can fix them going forward. Therapists collaboratively engage in therapeutic conversations, i.e. the miracle question, the exception question, helping clients construct solutions. Feminist family therapists typically are active in helping both men and women overcome stereotypical thinking about gender roles. They, like narrative therapists, help family members identify those damaging, culturally influenced sexist practices that stifle individuality. So if you have a son who is demonstrating some feminine characteristics, despite the fact that he doesn't appear to be gay or have any gender issues, but is just a little more feminine than the average boy, then the therapist would help the parents understand the continuum on which gender is now being examined, and that masculine women and feminine men are just part of the melting pot of gender. Psychoeducational family therapists are active teachers or coaches interested in teaching skills to aid in reducing family conflict. All family therapists engage in some form of evaluation within families, beginning with the initial session and continuing throughout treatment as the therapist gathers data and formulates and reformulates hypotheses. While some family therapists consider a formal assessment procedure to be central to their therapeutic planning, others consider it peripheral, believing that one should not sit in judgment of others. In other words, the client knows best what he or she needs. Whether formally or not, therapists make some sort of appraisal of new client families, if only by comparing to other families with whom they have worked. Behavioral family therapists are particularly interested in defining and, if possible, measuring the maladaptive problem, using standardized interview procedures and formal test instruments. Cognitive behavioral therapists are likely to employ questionnaires and inventories for each family member to get a sense of different perspectives about the family problem. Bowenians begin by gathering historical data in the form of genograms, allowing the therapist and family members together to ferret out family patterns extending over several generations. In the process, the therapist and the family obtain an inside picture of unresolved issues and family patterns from the past, and the family identifies issues that have hampered family functioning over generations. So, for example, if alcoholism runs in one's family, you can go back to your parents, your grandparents, your great-grandparents, and often identify the individual in those generations who carried on this alcoholic lifestyle that became a huge issue for people. Feminist therapists working with a couple might review with them a history of exposure to sexist attitudes or current gender discrimination that negatively affects optimal marital functioning. So over there on the right-hand side is an advertisement from the early 70s, mid-70s, somewhere in there. And it's a naked woman lying on the floor, staring adoringly at a hideous-looking men's shoe. And the tagline is, "Keep her where she belongs." In other words, under your heel, so to speak. And again, women who grew up in an era where women were seen as less than a man oftentimes have a hard time standing up for themselves and understanding that these gender roles were created by society and that they're not natural and that they're not part of God's plan. Structuralists, on the other hand, rely on observation of the family in action, mapping transactional patterns, provoking enactments to detect boundary problems such as enmeshment and disengagement. They might perceive the family as stuck at a transition point, needing to restructure but unable to move beyond the impasse without therapeutic intervention. Experiential therapists, especially cross-sectional here and now, help families search for suppressed feelings and impulses that need to be unblocked in order to gain greater growth and fulfillment. Social constructionists believe their view is just one of many perceptions of the situation, and the client's knowledge about themselves takes priority. Believing that they are not objective observers with a truthful interpretation of reality, social constructionists adopt the egalitarian viewpoint that they need to engage families in conversation, not evaluation. Solution-focused therapists focus from the start on simply finding the skeleton keys or general guides to move clients towards a solution. In this brief approach, problems are not uncovered and assessed. Rather, the thrust is towards solution development and client empowerment. Narrative therapists are interested in liberating people from a sense of helplessness and despair. Their persistent questioning is directed at exploring and expanding beliefs and visions about the future, not in gathering data for assessment or diagnostic purposes. There is substantial support today for common factors that are effective across a variety of theoretical approaches to family therapy, such as highly important client characteristics like readiness to change, motivation, willingness to work hard, personality, client needs, and cultural sensitivity, and the therapeutic alliance, including the shared goals and careful connection with the various individuals and dyads in family therapy. Just as many common factors work through models, models in turn work through therapists. The therapeutic process is seen as a multi-layered change process, including the client's change process, the relational interaction between the therapist and client, the specific mechanism within therapy, and common factors. This approach is consistent with the systemic properties of reciprocity and complexity in interaction. Despite the role of common factors across models, advocates of particular models rely on certain specific and defining techniques as noted below. Psychodynamic family therapists use interpretation to help clients understand the unconscious meaning of their thoughts, verbalizations, and behavior. Quote unquote, "You're afraid to commit to your relationship with Beyonce because you suspect your mother was unfaithful to your father and covered it up." So basically, what this psychodynamic family therapist is doing is taking what you're saying and interpreting the subtext or the meaning below the surface meaning. Bowenians question, coach, and encourage individual efforts at self-differentiation by teaching clients to take an I position expressing how they truly feel. And again, this is in that environment where someone would say, "I feel like I am not being heard." So there's an emphasis on the I and not on blaming with the "you did this and you did that." Contextual therapists appeal to fairness, promoting the balancing of the family ledger. So who is responsible for what, and how do we make this more fair? Structuralists work on clarifying boundary diffusion and use enactments to introduce changes in the family structure. Milan therapists use positive connotations and circular questioning to help family members learn about the perceptions of other members. Behaviorists and cognitive behaviorists attend to the contingencies of reinforcement, relying on skills training and cognitive restructuring to help families modify thoughts about the meaning of an event. Solution-focused therapists address efforts to arrive at successful solutions by utilizing a variety of techniques, including miracle questions, exception-finding questions, and scaling. The narrative therapist trademark is externalization, by which the problem is recast as outside the symptom bearer and the family is united to deal with the oppressive agent. By a series of persistent questions, clients are encouraged to adopt previously subjugated stories that replace negative and self-defining dominant stories. All family therapists must be prepared to help families in crisis. Whether dealing with a new referral or a family currently in treatment to whom a crisis occurs, the family therapist must respond without delay. In some cases, seeing the family daily for varying lengths of time during a critical period, usually lasting several weeks or less. For example, the discovery of a spouse having an affair, a sudden job loss by the major breadwinner, a suicide attempt by the adolescent, the accidental death of a child. These are crises requiring a quick therapeutic response. In severe situations, such as those involving danger to oneself or others, psychiatric hospitalization may be necessary. In all cases, therapists try to help the family discover its restitutive or resilient forces to reestablish stability, at the same time helping them, whenever possible, develop new and effective coping mechanisms. All family therapy models provide an opportunity for change based upon client perceptions of new choices. Differences arise between models in how they go about achieving this goal. Some, for example psychodynamic, do so by providing insight, whereas some, experiential, by encouraging open communication and emotional expression. Others, such as behavioral and cognitive, build skills in cognitive restructuring, some by expanding the family system through the use of reflecting teams or outside witness groups. Regardless of the procedures, all attempt to create a therapeutic environment conducive to self-examination in order to reduce discomfort and conflict, to mobilize family resilience and empowerment, and to help the family members improve their overall functioning. So, does integration work? Is it theoretically impossible to integrate theories across epistemologies? In short, one can meaningfully bring together divergent theories, but in doing so, one cannot consider these mixtures of different theories integrated unless they align under a meta-theory that accounts for all the divergent elements now newly reconstituted into a theoretically consonant whole. So basically the answer is, it depends. Dickerson notes the present-day trend toward integration, but argues that integration is possible only between the theories and practices that occur within specific epistemologies, and she identifies three: individualizing, systems, and post-structural. She asserts that one can integrate theories within each of these epistemologies, and one can adopt practices and some theoretical concepts across theories and across epistemologies. So, that is how many times you can say epistemology on one slide. Anyway, that's for today. If you have any questions, please feel free to email or text your instructor. If you're not in our class, please leave us a comment and we will get back to you as soon as we can. Thank you, and have a great day.